More details coming out of that Public Hospital Authority forensic report.
And a lot of the concern focused on inventory of prescription drugs.
Now, the report also pointed to nurses and doctors not properly distributing drugs to patients.
Tonight, Jay Noel Ferguson discusses the issue with a top physician and the president of the Nurses Union.
The dispensation of prescription drugs at healthcare facilities in the country called into question by a forensic audit report conducted on the Public Hospitals Authority. According to the report, based on information they've gathered, nurses do not record dispensed drugs, disobey the directives of physicians, and provide different doses to patients. It was also revealed that expensive medication and emergency medical equipment was allowed to reach their expiration date on the shelves instead of being distributed. The report furthered that a person interviewed went as far as describing the ward as a black hole for prescription drugs, which increased the risk to patients and wasted PHA's assets. Now, President of the Nurses Union, Janet Kofani, took grave exception to these claims and said that to even suggest that nurses would participate in this is absurd.
The directives always come directly from the physician. The nurse does not decide that if the doctor wants it IV, oh, I'm going to give it PO or I am going to give it IM. That just does not happen. It is always under the directive of the physician. She would have spoken to that physician who would have said, go ahead and give the patient what the pharmacist have, the route that the pharmacist have in it. She never does anything independently like that. When you take the whole content of the issue, it doesn't have a doggone thing to do with nursing. It has to do with some misplaced ordering of pharmaceutical drugs.
Now, heart surgeon Dr. Dwayne Sands also defended medical staff.
When you see nurses in particular who are trying to be creative in an approach to provide care, that they are facing real challenges with drugs, with equipment, with staff, with an environment which is not consistent with anything that professionals ought to be working with.
The report stated that the chief pharmacist and head of the inventory at PMH refused to meet with auditors. The report also cited $10 million unaccounted for medication. Former Health Minister Dr. Hubert Minnis claims that this is a clerical error. Now, that PHA audit also recommended that PHA do a better job of record keeping. It also said that more focus should be placed on information technology. Janae Noel Ferguson, Slackness Network News.